ML is a 42-year-old Pacific Islander female at the Bay Clinic Pahoa on October 5, 2011 as a follow-up visit for her diabetes management. I will be scoping her hypertension. The history of her present illness. ML has been continuously treated for her hypertension since she was first admitted to Bay Clinics in February of 2010 and has had a dry, persistent cough for at least the last year. She denies any dizziness or lightheadedness. Past medical history includes benign hypertension, hyperlipidemia, type 2 diabetes, schizoaffective disorder, and proliferative diabetic retinopathy. Her family history. ML has siblings as well as both parents who suffer from type 2 diabetes. Social history. ML requires a caregiver provided by her sister. Her diet has recently changed to eating smaller, more frequent meals. She has recently stopped drinking soda, and she has recently had her blood sugar under control. Immunizations are up to date. And the review of systems. ML states that since she changed her blood sugar medications from NoLog 7030 to Lantus, she has been feeling much better and has had much more energy, but she is still bothered by a persistent dry cough and is requesting to reduce the number of medications she takes. She denies any night sweats, lightheadedness, or fatigue since medication changed. Her vitals include height of 5'2", weight 77.7 kilograms, blood pressure 128/82, heart rate 96, respiratory rate 14, ideal body weight 54.5 kilograms, BMI 31.28, obese, BEE 1600 calories per day, creatinine clearance is 90 mils per minute. Physical exam. ML was alert to person, place, and time. She appeared well nourished, no physical, hearing, or visual limitations, and no physical assists. Her lab values include blood pressure, read on 8/5/2011 of 117/79. It was 106/78 on 5/2011, and on 3/2011 it was 110/70. All other values are within normal range, and she has no known allergies or intolerances. Her current medications include lisinopril, 10 milligrams by mouth once daily for high blood pressure. Other medications include Lantus, simvastatin, bupropion, topiramate, benzotropine, aspirin, docusate sodium, metformin, and trazodone. The risk factors for hypertension, as stated by JNC7, for all persons include age, being older than 55 for men and older than 65 in women, diabetes mellitus, elevated LDL or low HDL, estimated GFR under 60 mils per minute, family history of premature CVD, which includes under 55 for men and under 65 years old for women, microalbuminemia, obesity of BMI over 30, physical inactivity, tobacco use. The risk factors that are specific to ML include diabetes mellitus, obesity, and physical inactivity. ML's Framingham risk score is 24%. The need for therapy. Hypertension in ML is required to prevent long-term complications from hypertension, including myocardial infarction, stroke, and heart failure. Lisinopril is not appropriate for ML, although it is an ACE inhibitor, one of the first-line hypertension treatments recommended by JNC7. ML states that she has been significantly bothered by a cough for the last year, one of the known side effects of this drug. The current dose and frequency of 10 milligrams once daily is appropriate, as it should be within 10 to 40 milligrams once daily. The oral route is appropriate, as ML can swallow pills. Signs and symptoms of adverse effects include a dry, persistent cough likely due to lisinopril. Major therapeutic alternatives. For first-line treatments of stage 1 hypertension, given the compelling indication of diabetes, includes thiazide diuretics. These are not appropriate for ML as they can cause hyperglycemia, which should be avoided since her blood sugar levels have just recently been stabilized. Other ACE inhibitors are not appropriate due to the class in general being able to cause cough. ARBs, aldosterone receptor blockers. These are an appropriate alternative. There are no drug interactions or precautions specific to ML. There are beta blockers. The problem with this category is that they mask most signs of hypoglycemia, which may be problematic for ML, as she may have difficult understanding this concept, so they are not appropriate for ML. Calcium channel blockers can cause withdrawal effects, and as ML has known compliance issues, this is not an appropriate category for her. There are no drugs in ML's current regimen for which there is no therapeutic indication. There are potential interactions between trazodone and bupropion. Trazodone increases the toxicity of bupropion and can lower seizure thresholds. Recommendations. I recommend discontinuing lisinopril 10 milligrams due to patient complaint of cough. Recommend starting ML on the ARB category, losartan 25 milligrams to treat her hypertension. Avoid other drugs in the ACE inhibitor class, as these can cause or worsen her persistent cough. And avoid any sympathomimetic drugs in ML, as these can worsen hypertension. The goals of drug therapy is to maintain blood pressure in diabetics to under 130/80, as stated by JNC7. The monitoring parameters: as new medication is being started, we should recheck in 1 month to confirm controlled blood pressure. When stabilized, it can be checked every 3 to 6 months. As ML does suffer from diabetes, a complicating factor, routine lab work for urinary albumin excretion should be performed annually. And we should also routinely monitor her serum potassium levels. The drug-related side effects to monitor for her would be hypotension. Patient education. You will be taking a new medication for your high blood pressure. This one should not cause any coughing. Take losartan 25 milligrams by mouth once daily, with or without food. If you miss a dose, take the next dose as soon as you remember it, but do not double up on your dose. Keep this medication in a cool, dry, dark place. Notify your doctor if you become pregnant, as this medication should not be taken during pregnancy. It will be hard to tell if the drug is working. You will need to take this pill even if you do feel better, and we will continue to monitor your blood pressure for you when you come into the clinic. Although it is not common, you may experience an allergic reaction to this medication. If you have hives, difficulty breathing, or swelling in your lips, mouth, or anywhere on your face, get emergency help. You may feel lightheaded or dizzy after taking this medicine. Let your doctor know if you experience these symptoms. There are changes you can make that will help control your high blood pressure. You've already mentioned stopping soda and eating smaller, more frequent meals, and that this has helped you have more energy and control your blood sugar levels. We can make similar adjustments to your salt intake. Eating less salt will help get your blood pressure under control. I'm going to give you a handout that shows you how much salt is found in common foods, so that way you can make good food choices. Adding fruits and vegetables to your diet will also help. I am giving you some handouts about cooking ideas that will allow you to add these to your diet. And you have already lost over 10 pounds. Keeping this up will also help your blood pressure. One way to do this is by regular exercise. Now that your blood sugar is controlled and you feel more energetic, try to think of some activities that you would enjoy doing. I am giving you another handout that has some ideas for activities that you can try at home. Try a couple of them and see which one you like. Thank you.